Governor Holcomb's briefing will begin in 2 minutes. For the journalists joining us in the digital press room, if you'd like to ask a question, you can click the Raise Your Hand button. When you are called upon, we will unmute your microphone, and then you also will have to unmute your microphone.
Good afternoon. Thank you for joining us, and it's very good to be back in person. Physically distanced, but back in person. Everyone's doing well, including the state troopers, and just talked to a couple of them that got it initially, and they're all doing great. So everyone's recovered. We also have during this hour a couple special guests who will join us remotely up in Muncie and down in Newburgh, Indiana, and really looking forward to that. And then Dr. Box will, of course, give her update, and you're going to talk a little bit, you're going to elaborate on contact tracing and the immediate impacts that's the recent changes that have been underway, and the difference that is and will make as the days and weeks and months ahead unfold. And also I had a bit of good news. We're all in need of some good news during these days. And it's in regards to, and we've talked about this company before during this time, but Indiana Face Mask, based up in Rensselaer, Indiana, in Jasper County, a company that launched back in May, converted some of their lines and got into the mask manufacturing business. It's a part of a company of American Melt Blown and Filtration, and they stepped up and jumped through all the hoops and applied federally to be licensed to make N95 masks. And out of thousands of submissions, they were one of 5 in the nation that were approved right here back home here in Indiana, up in Rensselaer, and so we're pretty proud of that, and just wanted to say congratulations to the family, to all the employees, to all the teammates, to Fred and Stephanie and Clayton Geyer for their perseverance and for answering the call. They're doing more than face masks. They're doing other PPE products as well, but these N95 masks, and they're going to be able to not just produce millions, which is very comforting in and of itself, but they're also, this is one of those stories where they're going to end up hiring 14 more people to come help. And so that's a win-win-win all the way around. And again, just congratulations to the Geyers and to Indiana Face Mask for stepping up. As I mentioned, you're going to talk about the color-coded map and where we stand, all those indicators. We know that we're all kind of bracing for the next few weeks to unfold, and those lagging indicators that come off of holidays when people are traveling, when people are getting together with folks that they haven't been around extensively and intimately for a while. And certainly that was the case over the recent holiday, Thanksgiving. We did pull up a couple slides here from the Indiana Department of Transportation, and you can see that over a 10-day period and over Thanksgiving, our traffic was down slightly, about 30% on Thanksgiving Day. And so I did want to take just a moment to say thank you to everyone that said we're going to be safe, not sorry this year, and we're going to spend it with the folks that we're around normally in our very close family. And then when we do that, we're going to take all the precautions necessary because they're seeing what we're seeing and feeling what we're all feeling, and that is our capacity to care for folks is being strained and stressed, and our healthcare network. And so I just have a lot of thanks myself to pass out to everyone that decided to scale it back or scale it down this Thanksgiving. Hopefully we can do 2 next year. And with that, I will turn it over to you, Dr. Box, if you can get us up to date on where we stand statewide.
Absolutely. And that NIOSH certification
Yep.
that the masks got and the company got, it just means so much to our healthcare providers when they have the confidence to know that those masks are giving them the maximum protection. So congratulations. Thanks, Governor. COVID-19 continues to have a firm grip on our state. Our color-coded map has 16 counties in red this week and 1 in yellow. The rest are all in orange. While the number of red counties is down slightly from the 17 that we saw last week, we've not seen the impact from Thanksgiving gatherings at this point in time. That typically shows up about 10 days to 2 weeks after the event, so we'll be watching our numbers closely over the next week to 10 days. That's incredibly concerning for our hospitals, which remain at capacity in most areas of our state. The number of people hospitalized with COVID or COVID-like symptoms continue to rise, and it's over 3,400 today. That's almost double where we were 1 month ago. Daily hospital admissions also continue to increase at a significant rate. On October 1st, we had 85 people admitted for COVID or COVID-like symptoms. That number was 224 on November 1st, and we've already had 425 admissions reported for November the 27th, and that number could continue to rise as information comes in. This is forcing a number of hospitals to go on diversion, which makes patients travel further to find a hospital with a bed. That impacts not only those patients, but our EMS providers and others who might need their services. We also, unfortunately, are seeing an increasing number of deaths, especially among residents of our long-term care facilities. Yesterday, we reported 142 deaths due to this virus, and another 91 deaths were reported today. In total, 5,688 Hoosiers are confirmed to have died from COVID, and another 285 are considered probable deaths based on their clinical diagnosis. That's almost 6,000 Hoosiers who aren't here this year because of this virus. Each of these individuals has a name, a face, a family who loves them and is grieving. Many of them are Hoosiers over the age of 60. But no age group is immune, which is why we need everyone to help us turn things around by wearing your mask, practicing social distancing, and staying home if you're sick. And, I'm going to add, get the vaccine now when it's available. As the number of cases continue to grow, labs across the country are experiencing significant stress, and the time people are waiting for results has grown. I know this is incredibly frustrating. It's a supply and demand issue that every state is facing. We're working with our local health partners to try to help ease this by encouraging them to use the Bionex Now point-of-care tests for symptomatic individuals. We've distributed almost 270,000 of these cards across the state to local health departments, long-term care facilities, correctional facilities, universities, hospitals, and other locations. We also continue to explore additional labs that may have capacity so that tests can be redirected and we can spread out the workload. We're working to bring another lab on board that can take several thousand tests a day and hope to have them ready within the next couple of weeks. The increase in cases also has placed more pressure on the contact tracing system. We recognize that we needed to make some changes to our contact tracing process process because with more cases, interviews were taking much longer and we're seeing more cases lost to follow-up. To help ease this bottleneck, we've shortened our script for interviews of positive cases. Those changes took effect yesterday. The contact tracers will now focus on notifying the case of the positive result, sharing the guidance about what isolation looks like and information on social services if they need them, and concerning medical symptoms or signs to watch for. We will also emphasize the definition of a close contact and provide related quarantine guidance for those close contacts. The contact tracers will strongly encourage the positive individual to notify all of their close contacts. Remember, a close contact is a person who has been within 6 feet of you for 15 minutes or more throughout the course of a day. That includes a person who shares your household or a coworker if you are within that 6-foot space for 15 minutes or more. If you fall within that description, you're a close contact and will need to quarantine, even if you are wearing a mask. These changes will speed up the process and help ensure that people who have been exposed can take immediate steps to prevent further spread of disease. Our contact tracers will continue to gather information the person is willing to share about close contacts, but they won't be asking for a detailed list of symptoms of each individual. In just the first day of these changes, we saw a significant improvement in the number of outbound calls that our contact tracers were able to make. Our outbound calls were up by 64%. The number of people who hung up because they were tired of waiting was cut in half. The time people were on hold dropped. And the number of people who had to leave voicemails fell by more than 70%. We'll be monitoring this closely over the next week to see if these trends continue. We've also advised local health departments that they are experiencing a surge or crisis situations around COVID-19 to follow CDC guidance and prioritize case investigation interviews of people who tested positive for or were diagnosed with COVID-19 within the past 6 days. In an ideal world, we would reach every positive individual and every close contact quickly. But the rise in cases clearly signals that we're not living in ideal times, and we need every Hoosier to help us prevent the spread of COVID. If you're positive, think about who you have been in contact with within 6 feet for 15 minutes or more in a day. Let them know immediately that they may have been exposed and that they need to quarantine. Point them to the many resources on our coronavirus.in.gov website that explain what isolation and quarantine look like and how to do that in your home. Quarantine means staying home, preferably in your own bedroom, using your own bathroom, and avoiding contact with other people. The current guidance calls for people who are close contacts to quarantine for 14 days. However, today, the CDC has issued new guidance regarding the 2-week quarantine period. Under this new guidance, the 14-day quarantine is still available and should be used by people who encounter high-risk individuals, such as someone who works in a cancer unit or is immunosuppressed. But the changes allow 2 options for shorter quarantines. Quarantine can end after day 10 if the person has not had COVID-19 symptoms and they do not have to have a test to do that. Quarantine can end after day 7 if the person tests negative for COVID-19 on days 5, 6, or 7 and no symptoms have developed, but they still cannot get out of quarantine until they've completed day 7. Both alternative options require that the person adhere to strict practices of masking, social distancing, hand washing, and continuing to watch for symptoms through day 14. They also require daily monitoring for symptoms. I want to encourage Hoosiers to follow the 10 days of quarantine unless they have a job that cannot be done from home. Our testing volumes are extremely high, as I noted below, and that is taxing our entire lab system and prolonging turnaround times. We want to ensure that the symptomatic patients who need results quickly can get them and that we aren't creating any additional barriers. Every Hoosier has a stake in preventing the spread of COVID-19, and I'm asking all of you to do your part. We've been very fortunate to have many Hoosiers step up to do just that. Last week, I told you that 4,300 Hoosiers who responded to our Hoosier Healthcare Heroes Call to Action survey, and that nearly 250 college students who had stepped up to serve. Today, those numbers have increased to nearly 4,900 healthcare heroes and more than 1,000 student volunteers. I know our healthcare facilities and schools are incredibly thankful for this extra support, but I also want you to know that we still need more volunteers, more workers, especially in our more rural areas of our state. If you're a healthcare professional, a retiree, or a student with any capacity, please raise your hand. We need you. Finally, I want to provide a quick update on the status of COVID-19 vaccine. Both Pfizer and Moderna have now applied for the emergency use authorization from the FDA. We are preparing to receive limited supplies of vaccine as early as mid-December. This situation is evolving rapidly and information changes daily. But based on what we're hearing now from our federal partners, our hope is that we will have enough vaccine to cover frontline healthcare workers and long-term care residents by the end of December. Just last night, a CDC advisory panel took a vote on who should be first in line to get vaccinated, and I'm glad to report that its recommendation mirrors our vaccination plan. We've sent an initial communication to frontline healthcare workers who are likely to have contact with COVID patients to notify them that they are in the first priority group for receiving the vaccine when it arrives. We will be following up with these individuals when we have more details with specific information on how they can sign up and receive the vaccine. And we're preparing our communications for the next group that will be eligible. The vaccine planning has been in the works for many weeks now, and I want to thank all of our partners who have helped in this process. Things are moving quickly, and that's incredibly exciting. I hope it gives every Hoosier hope that we will get to the other side of this pandemic. Thank you.
Thank you. If we could, just for a second, Dr. Box, when you first shared that new guidance from the CDC, I did what most people who probably just, if they've heard it for the first time now, are doing what I did, and I personalized it to myself, and thought, boy, I wish I would have had that update about a week ago. But better safe than sorry, and I'd rather do more, not less. But, you know, I asked you, and it was pretty instructive, your response. Everything about this is a risk analysis and trying to minimize and mitigate and slow the spread, and our part in that. And I asked you, would you risk it by doing less, even with the comfort of a test and not being symptomatic, et cetera? Would you risk it and scale back? And you said, and if you would elaborate on that just for a second, about it depends on who you are and what you're doing.
Right. I think if your job, allows you to work from home and you can be just as efficient and just as effective there, I would finish out the 14-day quarantine, because that has, we in medicine, we never say 0 and 100%, but it's close to 0% chance that you're going to become infective in that time period and infect someone. But I think that some jobs require that people get back sooner. We already have healthcare workers, because of our staffing shortages, that are working, even though they know that they should be in quarantine because they're wearing PPE. I think if I knew I was going to be around elderly people or people who are immunosuppressed, people who are on renal dialysis, I'd want to be very careful. As long as there were other people there that could staff that, I would probably avoid that. I really think that this is going to help us get more kids back in school sooner. So I'm very, very excited about that. And I think it's going to give a comfort to our healthcare workers who are going back more quickly.
Yeah, going to help. Thank you. I mentioned there at the outset that we had two very special guests joining us today, in addition to the folks who will be standing by. As you all know, we've got about 800 members of the Indiana National Guard who have been deployed since last month, November, all over the state of Indiana, assisting long-term care facilities and our nursing homes. We have Staff Sergeant Myra Beltran, who is joining us from Muncie, Indiana. She's at Morris Woods Health Campus, and she's been working there for several weeks now, and doing things like screening employees and sanitizing the facility and testing employees and residents for COVID-19. And we were just hoping, Sergeant, that you could maybe give us an update on how it's going and what you're all doing there.
Hi, Governor. So what we do here is we help with the temperature check-ins. We do sanitation of like the high contact areas. So that way, if we have residents that happen to leave their rooms for any reason, we're lessening the risk of them, getting sick by contact. We also do, we also help set up and tear down COVID sites. We will help with administrative tasks if they're needed. But it's been a very eye-opening experience here for sure. I know that when you hear about healthcare workers and how tired they are, it's easy to not understand it because you're not in the moment, you're not in the zone, you're not living it. But now that we've been here for a few weeks and you see, how little it feels like we're doing, but how big of an effect it has, it really does put things into perspective. Because even, if you have a guardsman here taking a temperature, it means that there's a technician that can go help take care of residents that are really sick. Or, if you're sanitizing, you're lessening the risk for the residents and the healthcare workers that are already so busy doing 5,000 things at once, so it has been a very, very good experience, especially, when you think of service members, you think of people overseas fighting war zones and things like that. But guardsmen, I think that's what sets us apart, especially the Hoosiers, that hospitality sense that we have. And, we live here, we work here, and we do serve here. So it's been a good experience. It's been a very enlightening experience.
Well, I have a couple questions, and maybe you do as well, Dr. Box, but and you're going to be able to stay with us for the hour. Is that right?
Yes.
Yes, perfect. I know this probably sounds like I'm leading the witness, but and asking you to pat yourself on the back, but which you all are so humble and try to deflect all that positive attention. But how are you being received there on the ground in the facility? I mean, you're lightening the load for a lot of folks, and I hear from folks all over the state about your presence. I was just wondering if you could share what you're hearing just from a personal perspective.
So here, everyone has been super kind at this facility. I will say I have nothing but good things to say about Morrison Health Campus. Everyone's been so welcoming, and the more they've gotten to know us, I feel like the more that they've opened up. And we have had people tell us like, hey, we really appreciate you guys being here. When we're sanitizing, like I said, or even taking temperatures, that means that someone else can go help take care of a sick resident or someone that's really ill, or do something that can help another coworker. So, it's been, I'm not trying to like toot my own horn, but it has been
You
a
should.
lot of things.
I'm tuning it. Everywhere you guys go, they don't want to let you go. So, we keep hearing this, and it's just such, it's really wind in people's sails. Do you have any questions?
Well,
Yeah.
can you tell a difference in kind of the how the staff is feeling since you've been there? I think just sometimes an infusion of new blood just kind of helps pick everybody up at a time when they really needed it.
So, I don't know if it's just because everyone is so nice here at this facility, but everyone is always so warm and so welcoming to us. They always ask us if there's anything that we need instead of us. I feel like they're kind of like pampering us instead of us coming in and helping them, because every day it's, hey, do you need something? Did you know that you can have this? And let me show you where this is if you ever need it. Or, so it's been such a warm experience. And I know that it's kind of contradictory to say that because we're here helping fight COVID-19 in any which way that we can. But at the same time, they're like pampering us and just showering us with praises and making us feel welcome. So it does. I hope that we are making them feel as comfortable as they are making us feel.
Awesome.
How long have you been there, Myra?
I have been here, I think, about 3 to 4 weeks now.
Yeah. So you were one of the more initial waves of deployment.
Yes, sir.
You couldn't have imagined this deployment I'm imagining. This is not what you thought when you got called up, I'm sure.
Would you raise your right hand?
I had never in my life, when I first enlisted, I never imagined that I would be serving in the middle of a global pandemic. But this is what I signed up for as a guardsman, and I do it with pride. And even if it's just a little part, it's my part, and I'm honored to serve.
It's a big part.
That's a big part.
It's a
That's
big part.
awesome.
Thank you. Thank you for stepping forward and answering the call. We're eternally grateful for your service.
Thank you so much.
Long list of heroes, and
You're
and
right.
our Guard, like I said, everywhere they go, they are their sense of duty and then delivering on what they're there for has really made people almost become family, and you could just hear that in Myra's description. We also have, going down south, going from Muncie, Indiana, down to near the Ohio River in Newburgh, Indiana, we have Carly McCormick. And Carly is a registered nurse, director of staff development and infection preventionist at Woodlands Living Center there in Newburgh. And Carly, could you also kind of provide the same perspective or insight about the rush that you've been at this for a while. You've done this before, but this is a whole new world. And can you kind of tell us where we are right now from your perspective?
As far as with the National Guard and with the care of the residents in the facility, we are just trying our best to keep it out of here. I mean, the updates, the newness of everything, the things that you guys tell us on a weekly basis, it's Dr. Box said around here. So it is just making sure that we implement, we monitor, we keep the process going, and none of that is broken throughout the system, and you get the good outcomes you are looking for. Sometimes not so much, but it's not for the lack of trying or the lack of having what we need from you all in order to do that.
Has the Guard been, again, I sound like I'm leading the witness, but or I know the answer to this question, but has the Guard been critically important to helping you do your job under this kind of stress and strain and volume?
Yes, I'm so thankful. I'm so thankful that you guys did this. The first day, Alltop and Lane, they reported for duty, and we screened them, we tested them, we made sure that they were fit and ready to go. I gave them a brief orientation related to the regulations, what to do, what not to do, how to do it, and then they took it from there. So they are our main guys that come in and screen our residents, our staff every shift. So day one, I had shown them the process that we had in place currently, but we had a stack of paperwork that needed to be filed and just those tedious tasks that we really needed help with. And they have made it their own. It is really remarkable. They set up their own schedule to make sure that someone is always here day, evening, and night whenever our 80-plus employees come into our building 7 days a week.
That's awesome.
Wilson, the other night, one of our guardsmen, I got a phone call at around 11 Saturday night, and he said, it was actually one of my staff, and she said, the first words out of her mouth were, the Guard told me to. So not only are they making our process easier, but they are making sure that all the steps are completed. So it was an instance that she had a sniffle, and it was new, and I was able to act accordingly and prevent a negative outcome. Yesterday, we got a new guard, Irk. He reported for duty. I made sure he was fit. He came in because our guard Lane welcomed his beautiful, healthy baby boy, Maddox David Lane. And I briefed him. I did the education he needed, but Alltop took over from there. He knew exactly what he needed to do. He told them where he needed to be, what he needed to do, how the process worked. Made sure he had my number in order to be able to contact me whenever he needs. The handrails in a nursing facility, people don't think that much about that, but they are a form of transportation for some residents. That is how they get from point A to point B, and they make rounds 3 times a day, even more than that, to wipe down our common areas and our handrails. They make sure our PPE is stocked on all of our units, gloves, gowns, masks, what do you need? And then at the end of each day, they always report to me, making sure that I don't need anything else. And it is.
I hope General Lyles is
Yeah,
watching this.
yeah.
He's going to be so proud of him.
Yeah. Carly, you're just proving that we're in this together and we're going to get through this together. No matter how long it takes, we're going to get through it together. And I salute you. And I suspect that you've had some of these individuals that you listed by their last names. It sounds like you've already become part of the military as well. But they're saluting you as well. Thank you for. And you're going to be able to stay with us during the Q&A portion as well, because some folks may
Yes.
have some more detailed questions for what's a day like where you are. So with that, Rachel, we'll go right to the Q&A. Thank you, Carly, very much.
Okay. We will begin with Kathy of the Ferdinand News.
And by the way, Kathy, good afternoon. I think I misspoke. If you're about to hammer me on the number of guards, men and women, I said 800. It's more like 1,800. So
I wasn't going to hammer you on that, but I do appreciate that we have one of the finest guards in the
Yep.
in the whole United States.
Yep.
So
They're in it to win it. We love it.
I have a couple questions, and the first, and this is kind of a semantics question, I think, and I was asked by a bunch of library directors to ask this. In your, maybe not your most recent, but one of your recent executive orders, it said the county must meet the metric score of less restrictive category for 2 consecutive weeks before being allowed to move up. But I know like Spencer County was only in there 1 week. I think Du Bois County as well. And so I was wanting they were wanting some clarification on how that works.
You want to talk about the calculation and duration?
Right. So, Kathy, that's a good question. There's nothing set in stone about it. I think when you look at an individual county that's gone from orange to red, or we watch those counties that are hanging right at the 2.5, and we see their number of cases per 100,000 be extremely high that same week, we know that they're going up to red the next week. And so, I kind of hate to say you have to be here for this certain amount of time or you have to be doing X, Y, or Z, because when we look at the map, it's meant to take 2 of the most important metrics that we look at, one of which is the percent positivity and the other number of cases per 100,000. But it's only a small part of what we look at for a county to give and to work with them with regards to recommendations. A lot of it now is, what does the hospitalizations look like in the area? What do we see with regards to ventilators and ICU beds? All of that factors into the conversations and the discussions that we have about, what types of changes they may want to implement.
Well, thanks. My other question is probably also for you. I've had a letter writer who has tried to analyze the CDC data herself and says no more people have died this year nationwide than in the 3 previous years. And actually, her letter prompted a call from a scientist at Lilly who said, no, that's not correct. CDC does not do real-time data on their site. So I just wanted to confirm that officially, if that is indeed correct, because it's been an ongoing in the paper debate.
And you know what? I'll find that reference for you, Kathy, because I think it's really important. There have unquestionably been an increased number of deaths, not only across the United States, but here in the state of Indiana over this time last year and the prior years. There is no question that COVID is unfortunately adding to an excessive number of deaths. And we've shown that before, but I can certainly pull that up and make sure that you get that, because I do think that's really, really important that people understand that. I've heard a lot of people say, we're not losing any more people than we do with the influenza, and we haven't lost any more people. They're just saying that people died of COVID instead of dying of their stroke or their heart attack, and that's just absolutely not true.
And influenza cases are down at this time. If
Yeah,
you're looking at
and RSV, several other
Yep.
things, probably because some people are masking.
Right, right. And it's probably worth noting that in addition to Carly and Myra, I think Dr. Weaver and Dr. Dan are at the ready as well, if there's any specific questions for them.
Eric Berman, WIBC.
Afternoon, Eric.
Afternoon, Governor. Welcome back. I see the Razor did not make the trip. Couldn't resist. I had a question for you about the nursing home effort and long-term care effort.
Sure.
When you announced that about a month ago, we were seeing about a 3-to-2 ratio. There were far more deaths in long-term care than the population at large. That's been shifting over that time. We're seeing actually many more deaths in the general population than in long-term care. My question is, what, if anything...
Still about half, right?
Yeah.
I mean,
40 to 50%,
Yeah.
unfortunately.
Yep.
So my question is, what, if anything, are you looking at in terms of additional measures for the general population?
Well, I had a series of conversations yesterday, statewide, different geographic regions of the state, different sectors, elected officials, commissioners, mayors, folks in the private sector, business community, all over the state. We met, both you and I met with hospital leaders all over the state, representing different size communities, servicing different sizes of communities. And we discussed in part your question, Eric, is what more can be done. I think there were a couple common themes that came out of each of those discussions. One theme was making sure that we didn't have just one overall blanket policy, that we are working with local officials, whether it's our excise, our Homeland Security, our state fire marshal, our Department of Health, Indiana National Guard, et cetera, et cetera, et cetera. We are trying to work hand in glove to complement, and that also has some financial considerations. Obviously, we're trying to make sure we're steering dollars where they're going to make a difference in the numbers, and in terms of bringing that trajectory, bending it down where we are today in terms of the positivity rate and just the number of cases per 100,000, and the hospital rates as well. And so that comes down to a lot of education. We're looking at doing some more in addition to those conversations, including AIM, our association that deals with municipalities and towns, and our commissioners, as I mentioned, county government. We want to lean into communication efforts, because we know as local communities continue to respond directly to try to mitigate and to slow the spread and ease the burden on our healthcare network, it takes all of us. And so just reinforcing the message on the ground and equipping folks with the information, real-time data, to make informed and intelligent decisions. We'll continue to lean into that, and we'll continue to allocate resources, which includes, we're at about, for local governments, of that $300 million devoted, and it will all be used. But as right now, with a month to go, we're at just north of $240 million that's been already allocated, and we'll end up using that the difference, the balance, as well, and the $20 million that's available. That was one of the things that we talked about with commissioners and mayors, was how can we partner with you to get the word out, or what do you need to better enforce or ensure compliance. What I was so impressed with, and I'll quit rambling here, but what I was so impressed with the business community was their not just acknowledgement, but how they've shifted the way they do business in order to continue to not just produce their products or services, but also keep people employed and or address it so that we can keep our kids in school. That's where we ideally want them. It's got to be safe, and we're going to make sure that we're devoting resources there as well. And then also just letting them know, and we'll continue to do this, also had conversations with today with our 2 United States senators about what their discussions involve and include over the next, this week and next week. The House of Representatives, last time I checked, said that they were going home after next week. And so this is a pretty narrow window to get something done before the holiday. And just wanted to make sure that our federal partners and our local partners and us kind of in the middle are all talking with one another. I rambled on there, Eric. Did you have a follow-up? He got tired of my filibuster and moved on. Okay.
I lost him in the lineup. Eric, you can speak now.
There we go. Yeah, just going back to the funding question, what does that, but if I'm doing the math right, that's 60 million left to be allocated over the rest of the year, remainder of the year. What would that go towards? What kind of efforts?
Well, we're still looking toward the same efforts that the 240 million. I mean, they've got a month to get this done. Now, I also did include in my comments to Senator Young and Senator Braun that we would like to see an extension, some flexibility, obviously, but an extension going into next year. Obviously, this includes funding that we have right now and any additional funding in the next CARES Act or Part 2, so to speak. We know that the pandemic is going to be here in a week from now, in a month from now. It's going to go into this. We're going to be doing testing and tracing, and we're going to be administering vaccines mid to late summer at the earliest. And so that costs, and we want to make sure that we're accounting for that cost so that we're not dealing with the life and death costs that come associated with it. So we'll be looking at testing, tracing, assisting with local governments in terms of personnel. We're obviously following closely our unemployment insurance trust fund and wanting to make sure that I've said from the very beginning, there's two things that I'll always remember about the outset, going back to, I think, our first press conference. You said my number one concern is our long-term care facilities because of our health status. As a state and our rankings, not proud of it, not happy about it, but we're seeing the effects of that. And I said we want to do everything that we can, understanding that there was a lot of uncertainty out there about COVID-19 and a lot to learn. We're still learning. There's still a lot to learn, but that we needed to do everything that we could to get through this as swiftly and safely as possible, and that's a balance between our lives and our livelihoods. So it's those fiscals, Eric, are attached to both of those. On both sides of that ledger, the lives and livelihoods.
Brock Turner, WFIU.
Afternoon, Brock.
Good afternoon, Governor and Dr. Box. Two questions, one for each of you. I'll start with Dr. Box regarding these latest changes to contact tracing. Given the change, is it safe to say the state should have hired more tracers initially? And then just to be clear, is the state no longer notifying close contacts of positive cases?
No,
And that's just being the state locals might be.
Correct. No, we still are. If individuals on the phone, even though we're doing the shorter version of the interview, if they will give us contacts, we are still reaching out to those contacts in a text message and in a call if we don't hear back from them, hoping that they'll call us back. Should we have hired more contact tracers? When we started out, we thought that this would be more of a local thing. And you have to remember the locals have hundreds of contact tracers that they're working with also. So the fact that we have over 1,000 contact tracers centrally and are using a reach out by the phone, by a text message, and then the phone is been, successful right up until the time the numbers got out of control. Even places that have many more contact tracers than this, states are having significant issues trying to keep up with this. So I think the retrospectoscope is a really easy thing to make a judgment on, but honestly, I believe that this is related to our numbers, and that as soon as these numbers come back down, we'll be able to go back to the full contact tracing in the way we were able to before.
Thanks a lot for that. And then, Governor, in the last several weeks, you did reimpose certain restrictions. Looking at the level of stress currently facing hospitals and then the burden on contact tracing that Dr. Box just mentioned, should we have done more early on to avoid getting here and sort of stemming that curve back down? And then what are the thresholds that you're looking at in terms of implementing more restrictions down the road?
I mean, every day, Brock, we typically don't look back. I've said before that, I mean, if that's the direction you want to go is backwards, then look that way. But we're looking forward each and every day and trying to do more where it works. And this isn't there is no, magic wand where you can just say, we'll do this and it'll go away. No state in the country, and there have been a lot of different approaches to this. And so we look at what's working in different places, and what I just subscribe to is this has a lot to do with we, the people, as individuals, caring for others and taking steps and recognizing that any short-term sacrifice or inconvenience is tenfold worth it for the long-term gain. And so we'll continue to appeal and make sure that folks have the information as COVID-19 continues to ravage our communities and families, and make sure folks are equipped to make the right, safe decisions. And that means it comes with a cost, financial included. That sacrifice is a cost. I get it. But that continues to encourage us to lean in with, like I mentioned, state resources in terms of Homeland Security, State Fire Marshal, what I mentioned. And when you look at their effectiveness, and by the way, they're coming in because local communities are asking them to come in. They're coming in because they want help. They're coming in because schools and hospitals and the business community are talking to each other more and more and more. But to answer your question, we will never be able to do enough. No state, no country in the nation will ever be able to do enough. And every loss of life and every chair that was empty this Thanksgiving is heartbreaking. And if I could have done a lot more, I would have done a lot more. Or I shouldn't say just me. This is a huge team effort, meaning on the ground locally, here at the state, and our federal partners. I think you had a part B to your question.
I lost him in the lineup again. Hold on. Go ahead, Brock.
I actually think you answered everything. So thank you.
Thank you. I've been away. I'm a little chatty today, so I apologize. I'll quit filibustering.
Whitney Downard, CNHI.
Afternoon, Whitney.
Afternoon. I actually just have one quick question for Dr. Box. Dr. Box, neither of the vaccine trials that applied for emergency authorization included pregnant or breastfeeding women in their trials, and the Federal Advisory Council didn't make a recommendation on whether or not those women should get the vaccine. As a OBGYN, what would you recommend to the healthcare workers, some of whom may be pregnant, who are facing this decision whether or not to vaccine now?
Mm-hmm. That's an excellent question, and there's just not any safety information out there with regards to either of these vaccines for pregnant women. Again, we give all kinds of vaccines in pregnancy very safely. I think that the important thing for pregnant women, the great thing is to be able to vaccinate everybody around them. And we've always taken that approach around young children that can't be vaccinated and pregnant women. There will be more women that show up pregnant, maybe get the vaccine, don't realize they're pregnant, and then more studies will come out. And some of the studies are starting now, I think, to consider or maybe including them in them. But for right now, I think that's going to have to be a personal decision that individuals make. I do know that among our original healthcare workers, in addition to our ER workers and those that work in the ICUs, everyone who works on our labor and delivery units will be top priority to get immunized to help protect our pregnant women and newborns.
Dr. Weaver, are you available? This is not exactly Whitney's question, but could you just, and you're going to elaborate on this next week, so we don't need to go real deep into this, but could you just talk about, because we've received questions about, not just pregnant women, but school kids and children, and just give us the 1A, B, 2, 3, tranches, and then we'll elaborate on this next week. But just because folks are wondering, okay, I hear about the vaccine, it's looping on my television or radio or newspaper, but when me?
Yeah, thank you. That's a great question. So right now we know that these two vaccines have been trialed in people who are 18 and older, and we're looking really carefully at the data that they've already given us, and then we know that we're going to get more data over the next couple of weeks about exactly what is that breakdown of people 18 and older. So what percentage were over 65? What percentage were over 80? What comorbid conditions did they have? What was their race and ethnicity? So we'll really be able to break down all that information about the demographics that make up that group, and then we'll be able to make really good informed decisions about who we're going to offer that vaccine to. But they've only just now started trialing the Pfizer vaccine in kids 12 and older. So this will definitely just start with people who are 18 and above. Phase 1A, which is what we're looking to start here in the next couple of weeks, will focus on our healthcare providers. And then also the ACIP, so the CDC's group, also added long-term care residents to that group. So here in December, frontline healthcare workers, people who have the potential to exposure of patients that have COVID or to infectious material, and then long-term care residents, and of course the staff would be eligible for the vaccine. And then we'll look for more information about Phase 1B and Phase 2 and Phase 3 as we learn more information, not only about these vaccines that are going to be coming out, but the other vaccines that are down the pipeline. What is their safety and efficacy? And then again, look to the CDC for the ACIP recommendations on who's available for that Phase 1B. And then, of course, again, as we've mentioned before, we have our own group who we are communicating with on a very regular basis right now, our vaccine advisory group, that stakeholders, experts from across the state that will help us inform in our prioritization decisions.
I know you're ready to go, and please, both of you, don't throw anything at me, but of all three of these phases, none of them are mandatory, correct?
Correct.
Okay, perfect. Thank you, Dr. Weaver.
Trevor Peters, Fox 19.
Afternoon, Trevor.
Hi, Governor. Quick question for you on the vaccine front. We understand the Pfizer vaccine is incredibly sensitive. We learned from Governor Mike DeWine yesterday that there's only about a 2-minute window for the Ohio crews to move it from the freezer to getting it packaged on dry ice. How concerned are you that some of these limited doses Indiana is going to get may go bad and may be unusable simply because of human error? And who is handling the vaccines? And how will the state track and report when a dose you have is unusable?
Yeah, I see Dr. Weaver knows that it's on your watch, and you're managing this. And obviously we know about the temperature and the storage and the travel and when it goes bad and how we move from one phase saturation levels to the next. But maybe you could just address that we've actually run through this and run trials through this, and I actually have a high level of confidence, quite frankly, that it's not just logistics is in our DNA, but we're up for the moment.
Yes, you're right. So we've been working with our hospitals, our phase 1A hospitals, which we have almost 50 right now, to prepare for this. So they are fully ready and understand everything that is going to be needed to take the proper care of the vaccine, because it is really important to us that we waste as minimal as possible. And so the pharmacy leads at the hospitals are prepared. Not all of our hospitals will have the freezers, those ultra low freezers, to keep the vaccines in. And so the places that don't will actually keep them in the thermal shippers that will come with Pfizer. And then we've already received some detailed information exactly, when you take the vaccine out, it needs to thaw at room temperature for 30 minutes or 2 hours in a refrigerator. And they've been given all that information. So they're planning locally as well as with us so that they know exactly what are the expectations day in, day out, and they have to keep very close temperature logs. But these are the types of things that our hospital partners already do on a regular basis. So they're well prepared, and I too have full confidence in us.
And could you just, again, not trying to get you to share the whole story, that'll come next week, but the level of confidence that we have that we're not going to wait around and waste, that there's a certain saturation level percentage, and then we'll continue to move on. So we're not going to say, oh, we just didn't get to enough people. We've got the clients are out there, so to speak.
Yes, exactly. So based on how much vaccine we get, we're prepared to move through our different phases. So we will start by prioritizing a smaller group, just because we know that first week our allocation is going to be smaller. But then the next week, our goal, if we get the amount of vaccine that we're hoping to get or that we have projected out through December, we'll go ahead and open it up to all of our healthcare providers across the entire state. And so once we get through 20% of our healthcare providers that have actually received the vaccine, then we'll start to move on to other groups. But we're really expecting, at least here through December, that this will be just the phase 1A, so frontline healthcare workers, and then now also the long-term care residents.
And again, you'll walk through the who, the when, meaning the dates, the doses, meaning the volume that we have, and the where I will go to get my shot next week. Because you'll have the benefit, we'll all have, the country will have the benefit of the CDC meeting and their advisory opinions and approval for Pfizer first and then Moderna a week after. So thank you, Dr. Weaver.
Dylan Piers McCoy, Chalk Beat.
Afternoon, Dylan.
Afternoon. Thank you. I also have a couple of questions about the vaccine. What group will teachers be in for eligibility, and when do you anticipate they'll be vaccinated? And then my follow-up is whether you think that vaccinating teachers will be able to help keep schools open. We've seen so many schools close because of quarantines, essentially. So do you think that vaccines will be able to mitigate that?
So teachers are part of our critical infrastructure workforce. And as I mentioned earlier, a lot about who we're going to start vaccinating will depend on how much vaccine we get, when we'll be getting it, and what is the safety and efficacy for that vaccine. So they're in part of that group. So right now, ACIP is looking for that really to be more like phase 1B. We put it in phase 2, so they're all just different terminologies, but we will communicate as soon as we get more information. We literally learn something new every single day, and we promise to be transparent about, what is the planning moving forward and who do we expect to vaccinate next. But we are already in full planning mode to be able to start vaccinating that critical infrastructure when we have the vaccine and we're ready to do so. I 100% believe that teachers getting vaccinated will help our schools. Every little bit helps. So the new quarantine information that Dr. Box shared with you today, we believe that will help. People continuing to practice social distancing and mask wearing. And then, of course, yes, when the vaccine comes, every little person getting the vaccine will add to more people not spreading it around and not having to get sick and then have to stay home.
And not requiring a quarantine, right? So that's the good news.
Yeah, and you would encourage everyone to get the vaccine.
Everyone, absolutely.
Teachers included.
I would encourage everyone to do this. I'm I said this last week, and I really think people need to understand this is an incredible blessing that we already have 2 vaccines that we are ready to actually start injecting people with in the month of December, when this pandemic just really started about 9 to 10 months ago. So this is incredible. And I know some people in general never get vaccinated, and that is your choice and your decision. But I will tell you, this is the way we get back to the new normal.
Right.
This is the way that we are able to resume our lives as Hoosiers.
Julia with Wish TV.
Afternoon, Julia. I see Dr. Weaver's not even moving. She's just waiting. Okay, yeah. We'll come back to Julia.
Yeah, we'll come back to Julia. Jody with WRBI.
Hello, Jody.
Good afternoon. How are you today?
Very good, thank you. Yourself?
I am good. It's great to see that you are healthy and back with us again.
Some days I think I need a checkup from the neck up, but it's all good.
Don't we all
Yes.
sometimes? So my question is, where exactly is protocol listing for health departments with our local county jails? Specifically, I've had multiple sources call me over the last 3 weeks over one local county jail where people are reported not wearing masks. Inmates can refuse testing when they're sick. Cases went from 12 cases the first day of people calling to 104 cases in one jail within 4 days. And so local health departments are all saying they don't have any jurisdiction to help out in these facilities, and people are reporting that common areas don't get disinfected. So where does that stand?
Yeah.
That's a great question. And Jody, we've been working, Dr. Kristen Doss, as you know, who is the Chief Medical Officer for the Department of Corrections, has taken upon herself to work very closely with our local jails and sheriffs across the state. And in all honesty, the local health departments have also been engaged in some areas, but our team is backing Dr. Doss and getting testing to these different jails, talking about infection prevention, reiterating the need to wear masks and the importance of testing and isolating individuals that are symptomatic. I think that jails like Department of Corrections, like all the rest of us, are learning that when in a congregate setting, when this gets loose, it becomes overwhelming very, very quickly. So I truly believe that we are engaging boots on the ground in every one of these jails that's getting an outbreak. It is very difficult to control when we have multiple inmates that are, living in the same cell or room area and infecting each other. So they're doing their very best that they can to isolate it, and we are working to do the education around cleaning and sanitizing, wearing masks, socially distancing to the best of ability, and testing individuals that are symptomatic.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be next Wednesday at 2:30 p.m. Eastern.